The International Society of Lymphology has determined that any patient with a known insult to his or her lymphatic system is considered a stage 0 lymphedema patient. Now, stage 0 is a subclinical lymphedema, meaning you are not currently experiencing any symptoms of lymphedema, and you may never progress into a later stage lymphedema and may never experience any symptoms. But there are certain risk factors as well as risk reduction practices that you should be aware of to help you ensure that you never become a stage 1, 2, or 3 lymphedema patient. My name is Lisa Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart. What you need to know about stage 0 lymphedema is that you have had a change to your lymphatic system. Now, every human being is unique, and we all have certain subtle differences in our chemical makeup, including our lymphatic system. Some people with the exact same surgery and treatment protocol will get lymphedema, and some will not. Knowing what increases your risk and what you can do to reduce your risk is of utmost importance. Things that increase your risk for lymphedema are certain chemotherapies, radiation treatment, an elevated BMI, and the lymph nodes that are removed test positive for cancer. That's another one. If you've had a sentinel lymph node biopsy with no other treatments, your risk of getting lymphedema is really low, less than 5%. But with the addition of any of those risk factors, your risk increases. And if you combine more than one of those treatments, your risk can go all the way up to 50% or even more. At that point, the number of lymph nodes removed alone does not necessarily mean that your risk will remain low. If you've had a large number of lymph nodes removed, that doesn't guarantee that you will progress to a later stage of lymphedema either. I have had patients with only 2 lymph nodes removed who progressed to stage 2 and 3 lymphedema. I've also seen patients years after surgery with 20+ lymph nodes removed who've never exhibited any signs of lymphedema. So while this might be attributed to this person's individual unique lymphatic system makeup, it is still mostly unknown why one patient develops lymphedema and another does not, despite similar surgeries and treatment protocols. It's also really important to remember that swelling after surgery is normal. Everyone will experience post-surgical swelling. This post-surgical swelling should resolve in about 3 to 6 months following your procedure. Some people heal a little bit faster, some a little bit slower, but if you're at that 6-month mark after surgery and you're still experiencing swelling anywhere in the surgical area, or especially if it progresses into the surrounding limbs, I urge you to ask your medical provider for a referral to a certified lymphedema therapist, because we can help you reduce your risk of progressing into a later stage lymphedema. We'll do this by teaching you some self-manual lymphatic drainage, a home exercise program, proper skin care, and potentially getting you into a compression garment, as well as education to help you manage and reduce what you thought was still post-operative swelling, but is actually a progression into a stage 1 lymphedema. Signs of lymphedema include a visible swelling or a reduction in skin wrinkles or a reduction in visibility of bony prominences, perhaps a vague tightness, heaviness, ache in your arm or leg, numbness and tingling from the pressure of the fluid, maybe a change in the fit of your clothing or jewelry. Any subtle change that you notice after your surgery that was not there prior to surgery might be the earliest indication of a stage 0 lymphedema progressing. The most important thing I want you to realize is that there are no absolutes when it comes to lymphedema. Certified lymphedema therapists are uniquely qualified to help you deal with the side effects following surgery, the post-operative swelling that might progress into lymphedema, as well as later stage lymphedema. My goal is to help every stage 0 lymphedema patient stay a stage 0 lymphedema patient.